So I did my presentation on post-traumatic stress disorder. Post-traumatic stress disorder is a non-inheritable anxiety disorder that is formed after an individual has been through or witnessed a traumatic event such as murder, terrorist attack, or any tragic event. PTSD is included in the DSM-5 category. The DSM-5 category includes disorders associated with stressors and traumas. So there are many reasons that PTSD can be caused. Serious vehicle accidents, military combat, natural disasters, sexual assaults are all examples of why PTSD can be developed. There are many symptoms of post-traumatic stress disorder. Some of these symptoms include insomnia, nightmares, flashbacks, avoidance of talking about the issue or going places that remind you of what happened in the trauma, severe anxiety, and just being afraid, just having fear. Post-traumatic stress disorder is not curable, but there are many treatment options. One treatment option is therapy, specifically cognitive processing therapy. It's a 12-week course treatment with 60 to 90-minute weekly sessions. In this type of therapy, you talk to the therapist about how the traumatic event, affected your life and how it just hindered your ability to function in everyday life. And you write it down in detail and try to come up with ways to sort it out and cope with your emotions and feelings. Another treatment option for PTSD is medication. The category of medication used to treat PTSD is SSRIs. SSRIs is short for selective serotonin reuptake inhibitor. These antidepressants are used to relieve some of the symptoms and stress for the victim. SSRI medications include citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. So it was discovered in 1980 by the American Psychiatric Association. It was then considered a diagnosable disorder for all victims. Until then, PTSD was perceived as a mental disorder for mainly veterans who served in war overseas and had traumatic events over there. But in 1980, it was seen as a disorder for victims of sexual abuse, terrorist attacks, natural disasters, and more. In conclusion, post-traumatic stress disorder is a type of anxiety disorder that is caused by exposure to petrifying events. There is no cure, and even though treatment certainly helps an individual's mental health after the trauma, such traumatic events can leave emotional scars and could disable them from participating and functioning normally in their everyday lives.